call the meeting to order at 5:32. We'll say the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All righty. So did anyone have, first on the agenda is the review and approval of minutes. Did anyone have a chance to review the minutes? Any changes? Right off the bat, I have a change, which is that David was not the one who gave the community ID follow-up last visit. It was me. So I don't want to
Well, I wasn't here, so my skin's not that much in the game, but I noticed that there is no mention in the minutes of the fact that the minor issue of having had elections for new officers. So
that as well. Yes, that as well.
Okay.
Okay, any other thoughts, changes to the minutes from last time? So should we vote based on those changes being made or revote next meeting?
I move that we approve with amendment.
Okay, great. Vote to approve with amendment?
Aye.
David's. So the minutes are approved. So organizational issues, really the only thing is that Kiki, this is her last meeting. And so after this meeting, we will have 2 vacancies on the board. So if anyone has anybody who's interested, they can submit their information to the Board of Commissioners. I think everybody's done this more recently than I have, so fairly easy.
So I have one new member that will be appointed on Monday.
Oh, excellent. Okay.
Leah's husband, actually, Aaron Ocker.
Perfect.
He has an interesting background. He's an anesthesiologist in both pain management, but he does a lot of QI, QA work, which I thought is an interesting facet to bring to the board.
Excellent. So we'll have one opening then at that point.
I believe that Lee had also mentioned that she had another friend, acquaintance, or colleague who also had expressed interest.
I believe you're right. I haven't seen any paperwork come through on that person.
And I have I guess it's not as important because this, the newly appointed member has a means of understanding what goes on through personal acquaintance, but I think that we had started something where people who want to join have a chance to talk to members of the board, because we did have, over the course of my tenure, at least 1, if not 2 people who came on and it wasn't really what they thought, and one I can remember that then dropped out. So I think getting an opportunity to talk, particularly to the chairperson, but to members of the board before they come on board, I think is a good practice.
A good thing. Okay, thank you. Noted.
Yeah, so Maggie, if you have anyone who's interested and would like to speak, obviously Lee's husband probably, he's set. But anyone else, if anybody wants to speak with me regarding position before, officially applying or speaking with the Board of Commissioners, just let me know.
Perfect. I usually hear about them when they send in their CVs. So for that, they read it on the website, they send their CVs in. But if they're unless they're recruited by a member of the current board. So, but I think that's excellent. Thanks.
Great. So next up on the agenda is the student intern program. So any updates?
I have talked to my student Alice last week. We talked for a bit on Zoom, and she's progressing very well. She's got some slides already done for her program. She's met with a teacher at Radnor who's in charge of health and wellness, who's helping her a little bit. And I've actually set up a couple of different therapists at the college that I'm at who are happy to talk to her about any type of stress reduction techniques for adolescents. And so I think we will follow through with that.
Bob, any updates?
Yes, Hannah's here, so she can give us a update. We met a couple of times about her project, so Hannah, you want to give a quick update?
Yeah, so we decided to focus my project on examining the correlation between the nutritional value of the school lunches at Radnor High School and the academic well-being and performance of the students. And specifically, I'm looking into how the different lunch choices, whether students pack or bring their lunch, might affect their motivation and focus throughout the school day. And to gather this data, I'll be conducting a survey with the students, and I'm planning to ask questions like whether they pack or bring their lunch, and whether they feel motivated through the school day and how well they feel they're doing in school. And additionally, I'll be interviewing the school lunch staff to get a better understanding of the nutritional value of the meals that we're being served. And as a part of my research, I'll also be looking into the guidelines surrounding school vending machines, including the types of snacks and sodas that are available. And right now, I'm in contact with the guidance counselor, and we'll be doing probably a meeting next week or the week after, because we're in like the middle of course selections right now, so she wasn't free this week. But I'm trying to get the approval of my survey, and yeah. Thank you.
Great.
Well, I'm really impressed. And just a bit of advice, inventing surveys for wellness de novo can be a little fraught, and there are lots and lots of validated surveys that you can find by searching the appropriate literature online.
Yeah, and up until last year, we hadn't really had any success with students having surveys, but last year they showed that we can make it work. So I would just basically try to get it approved as soon as possible through our school contacts. Any other thoughts or comments? Okay. So next, we have upcoming programs, including this evening. They're having a listening session here from 6:30 to approximately 7:30 with Savage Sisters, which Kiki has helped organize. And anything you want to add regarding that? Or I think pretty much we had discussed what it is last time, and I know there was a link online for people to sign up for it as well. So a few other programs. I did want to call attention to at the school, at Radnor High School, they're actually having someone from the Care and Treatment Centers, who's an Education Alliance specialist, on March 13th from 7 to 8 at Radnor. And it's basically talking about substance use prevention and education. And that's available. I mean, it's on the Radnor High School website, so it's supposed to be for parents of Radnor High School students, but I don't see why somebody else couldn't also attend. And basically, they're going to be talking about current substance use trends, effective communication skills while talking with kids about substances, importance of establishing like clear rules and consequences for use, et cetera, and then also have additional resources. There's also a program tomorrow evening at 7 o'clock here in the Radnor Shire Room, which is the Radnor Township Environmental Lecture Series. And this is based on the Delaware County Sustainability Plan, which was published in August of 2023. And basically they have 6 sessions which are planned to discuss environmental issues, but including health and wellness, so I wanted to mention that. Talking about climate resiliency, natural resources, energy and efficiencies, transportation, zero waste. So this is from the perspective of the Delaware County Office of Sustainability, and it's going to be given by Rebecca Yurkovich. And it's a 45-minute presentation followed by questions and answers. So that's going to be tomorrow evening at 7 o'clock here in this room. I also wanted to mention that I am in the future going to try to have someone from the Delaware County Health Department come and speak with us about some of their initiatives, but I did do a review of their website, and they actually have a really wonderful basically option for testing, which I hadn't heard about. Now, there's 3 locations, so one's in Chester, so a little far for us. One's in Yeadon, far for us. But there's also in Media at the Delaware County Government Center. They have reveal or cut ribbons for what are called test and go kiosk machines. And they're supposed to like help with health equity and improve access to public health resources. So the main thing is that they have a option for testing options for a PCR panel for COVID, flu A and B, and RSV that you can take, perform, and then return. And they return it at the kiosk. So it says once residents return their specimens to the kiosks, they will receive their laboratory results within 24 to 48 hours via email or text. So I know Media is not right around the corner. These tests are available at CVS as well, although not for RSV, but for the flu and COVID. But this would be a good option for people who don't want to pay for the tests. They're also actually making available sexually transmitted infection laboratory tests as well. And then they're also, and this I'm not sure if it has occurred yet. I know it had not at the time of the press release about a month ago, but the plan was also to have Narcan, which we've obviously talked about here, test strips for like diabetics, condoms, feminine hygiene supplies, and first aid kits, all free for residents. So it looks like a wonderful opportunity and wonderful thing that the health department's done. And it was, I just wanted to say who it was. So it was Delaware County Health Department, the County Council, and Keystone First who have made this happen. So once again, the one in Media is at Delaware County Government Center on Front Street. And the initiative was funded partly by a federal COVID-19 testing grant through the Pennsylvania Department of Health. So I didn't know if anybody else had any comments, questions about other kind of upcoming programs. That's not really a program, but just an initiative by Delaware County.
You might not be surprised that I might have a comment. But I thanks for bringing up the Environmental Action Committee piece, because I would have raised that if you hadn't, and I appreciate that you do. It's actually, there's a series of talks, and I've received notification from them. One of my more disappointing aspects, I always had wanted to bring the Board of Health closer to the Environmental Action Committee. I was not particularly successful in that, and I'm hoping maybe as we move forward that can happen, because when you talk about ingested substances, what we breathe and what we drink and what we listen to have major impacts on health, and I think it would be a natural fit, so thanks for bringing that up. Also, thanks for bringing up the county, because I think as we see a dramatic decrease in federal organization and federal resources, although that was apparently funded by a federal grant, but as those resources go away, we will have to depend on the state and the county more and more for the attention that we need to pay to public health.
I just noticed this yesterday, so I didn't get a chance really to call and, find out exactly like kind of how these kiosks work, right? Because I'm sure you can't go up and just be like, we'll take one of everything and kind of take everything out of the machine, right? But I will kind of look into that for next month. So if anybody is interested in that, I'm assuming you have to give some type of ID or something, but I am told that it is free of charge. So it won't be charging a credit card or anything like that.
One quick comment. When you were talking about the county health department and, kind of keeping an eye on it and whatnot, and then the Environmental Advisory Council as well, there's one thing that the Planning Commission and the Shade Tree Commission do is that they have a dedicated person that either watches on YouTube or attends the meeting of the other group. which gives a little insight and they can report back. So it's one, I just wanted to bring it up as one way to do it. I mean, I'm not sure that somebody has to attend either the county Department of Health meetings, but you could probably watch them, or the EAC, but it's one interesting way to kind of spread the labor about.
If anybody is specifically interested in doing that, like I said, I'm going to try to have somebody come from the county health department either next month or April. I sent out those emails. So hopefully we'll be able to have someone come in. I know they are very busy right now with like the state of hospitals in Delaware County. The prospect who is in charge of Chester Crozier and of Taylor Hospital has filed for bankruptcy, so they're trying to find a new buyer. And in the meantime, basically, the state is assisting with keeping those hospitals open. And those are obviously both located in Delaware County. So they have had their hands full with that. And, you know, it's not real close, but it does affect overflows at other ERs. So the less people that are able to go in Chester, the more we're going to see Paoli, the more we're going to see Lankenau, the more we're going to see the hospitals around here even busier than what they already are. Which brings us to busy hospitals and the community infectious disease follow-up, which David has generously agreed to continue.
It's kind of you to ask me. Is Ian, are you in the back? Because I'd asked him to prepare a couple of slides. There we go. So these days it is really, really hard to separate politics from public health, but for our comments here, I want to try and stick to the science, and that's why I wanted people to see this slide. I thought that it was particularly apt in describing the difference between what you can do when you, quote, do the research on X or Insta or whatever the web searching that you do, and what actual science is, which is creating hypotheses, testing hypotheses, and using facts to drive your opinions as opposed to your opinions to drive the facts. So it might not surprise you that the first topic I would take up on community-acquired diseases, I would say, is measles. And so Ian, can you advance the slide? While I'm talking about what's actually going on now, there's a slide that I'd like you to see. That is the number of cases from 1962 to 2023 of measles. And if you don't believe that a measles vaccine is effective, I might ask you to have a look at that slide. And the reason I bring up measles now is that in the United States in 2024, there were 285 reported cases of measles, 16 outbreaks, which are identified as 3 or more related cases that were reported among those 285, and 69% of cases were outbreak associated. And the reason that's important is sporadic cases from a point of view of epidemiology are not the same as outbreaks. To compare that, in 2023, there were 4 outbreaks and 59 cases. So that's a 5-fold increase from 2023 to 2024. In 2024, 120 of the cases were in patients under 5 years, and the hospitalization rates were highest in patients under 5, and 89% of the cases were in unvaccinated or unknown, which is presumed to be unvaccinated, and only 4% were in cases were in individuals who had both shots. And 40% of cases hospitalized for isolation or complications, 40% of cases. So if you go back to 500,000 cases a year in the early 60s, if the hospitalization rates were the same, which they probably weren't, they were probably in the 15 to 20% range then, but still we're talking about tens of thousands of people hospitalized and hundreds to thousands of people dying and having long-term complications from measles prior to the advent of the vaccination. My notes here are terrible. So in 2025, as of February 6th, there had been 14 cases, not a big deal. 6 of them, were hospitalized, and all were unvaccinated. However, the Texas Department of State Health Services reporting on an outbreak of measles in South Plains region of Texas as of February 18th. So between February 6th and February 18th, there were 58 new cases that are considered an outbreak. This is what we can look forward to. The other slide I should have provided for you was that as a consequence of mandating MMR for attendance in school without particular exceptions, we had vaccination rates that were as high as 96% in 2022. That has dropped to 91%. There has been a threat by the federal government to take economic sanctions against school districts that actually mandate inoculations. I don't know where that will go, but it has been proposed. So I think we can expect substantial exponential increase in measles outbreaks. There are no treatments. The complications are encephalitis, pneumonia, and death. And as we see, children under 5 years old are most susceptible. And I think that we should support our school district in having fairly draconian standards for both inoculation and for school attendance in the event of measles outbreaks. One man's opinion. The next area that is getting a lot of attention is what is called avian flu, which is probably more accurately, although even that's not even accurate, H5N1 flus, which also include H7N2 flus, but bird flu. And you're hearing a lot of noise about bird flu, and because there's a lot of bird flu out there. Fortunately, as of right now, there are only 68 human cases with 1 fatality and 1 other severe case. We'll come back to that. But it is in your dairy cattle. It is in your beef cattle. It is in your commercial pork farming community. It's in your egg-producing poultry populations, which there are outbreaks not only here, but in Southeast Asia, Asia, and Africa. It is in migratory birds worldwide. It is in the feral cat population. It is in the domesticated cat population. The importance is not yet clear. Everybody is on tenterhooks about a global epidemic or pandemic. As of right now, there is animal-to-animal transmission among the various species that we've talked about and between those species, but all of the human cases can be accounted for by animal-to-human transmission. And they're predominantly in workers, predominantly in poultry, in dairy, and in poultry farming businesses. But the presence of the virus in very large quantities in these populations, especially in the cattle and in the pig population, provides an arena where this virus could mutate into a virus that is directly transmissible human to human, and that's what everybody's been waiting for. But it hasn't happened, and it hasn't happened in prior outbreaks. However, it is not without consequences. It's a contributor to your price of beef. It is a contributor to your price of pork. It is a contributor to your price of eggs. The last duck farm on Long Island, when I was a kid, Long Island duck. The last duck farm in Long Island has been compelled to destroy its flock of 100,000 ducks and does not believe that it will be able to survive. So it's not without consequences. Which brings us to another topic that is relatively hot, and that is raw milk. The science behind raw milk is that there is evidence to suggest that there might be some health benefits of raw milk as a part of living life on the farm as a youth. And the Parsifal study, if you want to look it up, is worth looking at. A Parsifal, I believe it's a Swiss study, but I'm not certain. It is clear that if you grow up on a farm that's in close association with a town or city, the kids who grow up on the farms have less allergic and infectious diseases than the kids who grow up in the city. And that has led a lot of people to believe, well, raw milk is really good for you. Well, growing up on a farm is not just drinking raw milk, and it's not necessarily raw milk, it's farm-associated milk. And there are scientific rationales and hypotheses for contents in the milk, including antibodies and including its effect on the microbiome that might have benefit. As of right now, there is not a shred of scientific evidence to suggest that if you take up drinking raw milk at 62 years old, that you're likely to get any of the benefits of raw milk that might be imputed by these studies of life on a farm. But there is a possibility that our current process of pasteurization might be deleting certain positive aspects of the milk that you drink. And I'll go back and remind people that before pasteurization came into common use, 50,000 hospitalizations and 10,000 deaths a year were not uncommon from the utilization of unpasteurized milk as a consequence of Salmonella, E. coli, Campylobacter, Staph aureus, Yersinia, Brucella, and brucellosis, the most common one, Coxiella and Listeria. And the Listeria and the Campylobacter are also highly responsible for premature abortions in pregnant women. So what we do know is that unpasteurized milk has significant health risks that include severe disease and death. And we do know that there is a putative and potential benefit of raw milk, and I heartily recommend people make wise decisions as to whether or not they choose to drink raw milk. I also think that if we had a public health policy, it might be possible to explore the possibility of pasteurization processes that might be able to preserve some of the components of milk which people feel might have been lost in the pasteurization process and still protect from predominantly bacterial diseases. But I brought that up after avian flu because there are huge herds of cows that are producing milk that is filled with avian flu, and pasteurization does have, I think it's the 3 log-fold reduction in the viral content of raw milk. So I would keep that in mind. The last thing I'll give you from what I could glean, because it's really hard to get information these days, is that influenza A has gone crazy. It is very high in Pennsylvania, New Jersey, Delaware, and Maryland, so your general vicinity, as well as some of the states in the Midwest and Texas. Although it is, let's bring up vaccinations again. Vaccinations have a limited effect but probably measurable effect on getting the flu, but they have a dramatic effect on flu severity and flu duration in those who do get it. It's a little bit late to be getting the inoculation, but if you haven't had it and you're going to be afoot in places where flu is common, then one should consider, because we still probably have 8 weeks left, maybe 12 weeks left of flu season, and you might get some protection were you to get the vaccination now. Influenza A is predominantly, just to reiterate, it's predominantly fomite transmitted, although it is possible to get airborne transmission. So if you are in an environment where you know that there is flu, there is a value to mass protection, but the main protections are hand washing and non-face touching, which is another reason to wear a mask. It keeps your hands off your face. But that's the main mechanisms of transmission. And there are excellent antivirals which clearly shorten the effect, including neuraminidase inhibitors, of which there are 3 on the market, and a cap protein inhibitor, of which there's 1 on the market. So if you have been exposed and you start to become symptomatic, contact your doctor, or if you are a particularly high risk, elderly, very young, and the same diseases that made you, put you at risk for severe disease in COVID, for example, the possibility that you might want to keep a course of an anti-flu, antiviral on hand might be discussed with your physician. It's nearly impossible to get any valuable information on COVID. RSV seems to have run its course before the new year. There is still mycoplasma out there. There is still norovirus out there, and it's hard to get data on pertussis, which was running wild in January, but I'm not hearing much about pertussis at this point. And that is my overtime report on community-acquired diseases. Thank you for your kind attention.
A few comments, you know, as practitioners, we obviously, we're seeing a specific subset of patients, so I'm not sure we can make any vast, you know, saying this is up or this is down. But I will say that I have been having a lot of patients who have had norovirus and flu A recently, some COVID. Fortunately, no measles around our area. One comment on measles, which you alluded to, which is that we think that we want greater than 95% of the population to be vaccinated, and that's what prevents epidemics. In this area where this outbreak is in Texas, they have a 18% vaccine exception in their schools. I mean, part of that is there's a religious group there that does not believe in vaccines, but there's obviously other individuals in that community as well. So they had an 18% vaccine exemption. And just keeping in mind that the first MMR vaccine is usually administered at age 1, so babies are not protected. There is that if you're in an area, like they're telling people in Texas, that if they're in an area in which this is happening with measles, you can vaccinate at 6 months if there's a high risk of exposure. But in general, that's not happening until 1 year. Any other comments regarding community disease, infectious disease follow-up?
So I'm in a population where we're still seeing a lot of flu A right now, but looking at the dashboard for the county, we see the numbers are still high but decreasing. And I feel like that's pretty much the consensus on the colleges. If we keep tabs on all the colleges in the area, still seeing high numbers but decreasing, starting to decrease. We're not seeing a lot of COVID in the adolescent.
So I did want to add something to what I had said about avian flu, because what you just said, these outbreaks wear themselves out. Herd immunity takes place. One of the interesting observations about avian flu was that there has been antigenic response to H5N1 flu detected in asymptomatic veterinary workers. And that's something that I always like to keep in mind in making decisions around what you do about any outbreak is, what is the actual clinical syndrome? And it turns out the clinical syndrome in avian flu might be a mild clinical syndrome. There may be a lot of asymptomatic avian flu out there that we're just not aware of, because the 68 cases, they probably are 2 orders of magnitude less than the actual number of symptomatic cases. And there may be a lot of asymptomatic disease out there. I raised that after what you said, in that I am not aware of any evidence anywhere that influenza A can occur as an asymptomatic infection. Doc? So I guess from a Board of Health point of view, if your kid has a fever, don't send them to school. If your kid's friend has a fever, don't send them to play. If one of the kids on the team has a fever, don't send them to practice. Try not to spread it around, and wash your hands. Don't touch your face.
I believe we did not have any old business, so as far as new business, Maggie, could you give us a Board of Commissioners update?
Sure. We haven't had a whole lot, but I do have one issue for you tonight, and 2 points. The first one, I'm just going to tell quickly, it's not really a public health issue, but we've spoken about it before, and I just wanted to give you an update. I asked for at the last Board of Commissioners meeting an update on the bridge strike deterrent system that's on King of Prussia Road. It had been in place for a year. It was put up last Valentine's Day with a yellow bar on a plastic chain that went across, and it did pretty well. What would happen, though, is when it froze, the chain would break as soon as it was hit. So half the time, they'd be waiting for Public Works to come and fix it. They were out there 50, 100 times, or Ricky said some huge number that they were out there. So in August, we changed it to a more robust system, which is metal chains with these, kind of looks like PVC pipes with some reflector on it. So since there had been 2 bridge strikes with the original system, there have been 0 since August. So appears to be working. We'll wait and see. I just wanted to update you about that because we had talked about that in the past. So the second issue is an issue for those of you that have been on the board for a while that's rearing its ugly head again, and that's dogs on leashes in parks in Radnor Township. We have 4 types of parks in Radnor Township. Parks where dogs are not allowed. Obviously, it's not an issue there. We have dog parks where dogs are meant to be off leash. Not an issue there. We have Harford and the Friends of Radnor Trail Dog Park. We have the third, which is sort of half of the parks where dogs are supposed to be with their owners under control. And then we have a separate ordinance for Skunk Hollow, which are walking trails, hiking trails, a lot larger area, sort of a unique area, which was part of what brought it up with us before. We did pass an ordinance not quite a year ago that said that people need to share, basically. That most of the time, dogs under control with their owners, but not on leash, are okay. But people that are either afraid of dogs or don't want to get jumped on and don't want to get knocked over have rights too. And we gave them noon to dusk on Saturdays, Sundays, and township holidays to be in the park. Dogs may be there, they just have to be on leash. Wildly, enforcement is obviously the issue there. Dogs, nobody's paying any attention to it. So it's come back up with a issue at Parks and Recreation where it's been discussed the last several meetings. The police have also put in their 2 cents that their belief is that dogs should be on leash. It's safer for the dog and safer for the humans around the dog, which is essentially what we said when we were asked about 2.5 years ago about this issue. At this point, it's going to be discussed again at Parks and Recreation and will come back to the Board of Commissioners. The current recommendation is basically to keep it the way it is now, so that dogs need to be controlled but don't need to be on leash in the parks that allow dogs. But it was asked of me this afternoon to bring it up here and see if the Board of Health would be willing to make a statement about this issue, about their feeling of dogs off leash in our parks. A bellwether, national parks all have dogs have to be on leash. Our state parks in Pennsylvania all have dogs have to be on leash. The surrounding communities, other than dog parks, have, then there are a few trail parks. There's one in Lower Merion, which they consider under the auspice as a dog park. Otherwise, dogs have to be on leash. So the question is, why is Radnor sort of not following that, and what are the public health concerns? I mean, I see it as dogs can bite, dogs can push people over and break their bodies. They have feces, which are not great when on athletic fields, on walking trails. In Skunk Hollow, you see it right and left. You know, I think that there are a lot, rabies, of course, is an issue. We've had rabid animals recently in Skunk Hollow and with interactions with dogs. So I'm just bringing it up, and I'll put it in your lap and see if the Board of Health would like to make a statement.
So thoughts? we make a statement, then we have to have something that we all agree on. So who wants to go first?
Well, Maggie, you had mentioned, we did provide a statement from the Board of Health to the Board of Commissioners a couple years ago, or did
We
not?
did a verbal statement. It wasn't written down.
Do we have a record of that verbal statement?
Well, it should be at a meeting. I mean, the transcript of a meeting or the minutes of a meeting. I can't remember exactly when it was, but I could go back through notes and see if I could figure it out.
It was when Joan was still here, correct? Okay, so that kind of narrows it down a little bit. For those, I'm not sure everybody on the board knows Joan, who was a member of the board, left a year and a half ago. Does that sound about right? And she was a veterinarian and assisted with a lot of the updates to the township's laws on animals, basically animal control, different things like that. So, yeah, I feel like we did make a statement at that time. So, yeah.
So was there a component of the ordinance that included leashing responsibilities? Do you remember?
Well, the ordinance is written as under control for most places, not leash.
So under control, not leash.
Right.
So it doesn't
With your
state
owner,
leash.
under
Yeah.
control, but not necessarily leashed. There is a very large contingency of the public who feel strongly about this, that their dogs should be allowed to run off leash. They're pretty intimidating, frankly.
So my great-grandfather was a horseman, my grandfather was a veterinarian, my father was a veterinarian, and I love dogs. I think dogs need to have the ability to run. The question isn't whether dogs should be allowed to run, it's a matter of where should they be allowed to run, seems to me. Also seems to me that there is no adverse implication for the dogs to be under control, I'd like to come back to that, or leashed in public spaces where there are individuals who have the right to share the public space, who might be intimidated by or hurt, or even hurt seriously. And so from a public health point of view, it seems like an imbalanced issue, that the dogs can run elsewhere than in public parks, and the public parks are to be shared. Now, you might want to have a discussion as to what proportion of the acres of public parks in Radnor might be unleashed dog friendly and what are not, but the notion that there should be parks where dogs are compelled to be under control or on leash, I think should deserve, I don't know that the Board of Health has any more than anybody else. It just seems to make sense that that should be the case. And it sounds like we have ordinances, and I think it's like all other things. If the speed limit's 45 and everybody's driving 60 and nobody gets a ticket, everybody's going to drive 70.
No,
and-
that's what I said. It's an enforcement issue.
It absolutely
But,
is an
it's
enforcement
hard to
issue.
take our police from the streets and put them at Skunk Hollow to enforce hourly whether dogs are on leash or not. Or, I mean, it's easier for them to enforce a park that does not permit dogs, and they see a dog there. They can see that on a drive-by. Skunk Hollow is a long trail. I mean, you have to really get in there, and we do have some citizen police that have been helping us with this, as far as reminding people of the rules. This is not a group of people that's polite when you say your dog needs to be on a leash during these hours. I mean, of course some are. Many are. Probably the majority are. But there is a contingency that is not.
This sounds like a 50s movie with a motorcycle club.
So repeat this again, Maggie. When are the dogs have to be on leash in Skunk Hollow?
So the
Weekends?
Skunk Hollow ordinance is not really, it will be reviewed. When we put it in, said it needs to be reviewed in a
Oh.
year.
Okay.
And that is noon to dusk, Saturdays, Sundays, and township holidays. Sorry, I had a throat lozenge in my mouth. The question is whether dogs in parks in general, not dog parks, not Skunk Hollow, and not the ones that don't allow dogs, because it shouldn't be an issue there at all. But the parks, which is about half the parks in Radnor Township, allow dogs under control right now, whether those dogs should have to be on leash. Obviously, if you walk your dog down the street, they have to be on leash. Anywhere out of your yard except these parks and Skunk Hollow and the dog parks.
So how does enforcement of leash laws on North Wayne Avenue take place?
If someone sees you with a dog that's not on a leash, and if a police officer sees you, they'll cite you.
So it is a matter of manpower, person power and enforcement. Raise the fines.
Well, the question is, do you change to an ordinance that is unenforceable? That's a difficult and not a Board of Health question. I think what they're looking for is whether, as you said, David, as we said last time, whether we think both dogs and people are safer with a dog on a leash. That's really the only question, unless you want to get into feces. I could have phrased that one differently. Deep feces, how about that? In any case, I don't need a statement, but everybody think about it. I'll bring it up again at the next meeting and see what you think. This isn't going to be addressed in March. It'll probably be addressed in April by the Board of Commissioners.
Okay, so we do not have a school member today, so we will skip the school board update. In the other department, we had briefly discussed last time, but I hadn't really gotten on the case yet because I was trying to get in touch with the County Department of Health so we can get them here, is that if anyone has someone who would be willing, a colleague, to speak on tick-borne illnesses, because that was a thought that was brought up by the public. I do not feel I am an expert in that. I had also brought up, as an endocrinologist, I have a lot of experience with the weight loss medications, which is a real hot topic right now. So I would be willing to discuss that at an upcoming meeting. I know I'm hoping for the department, like I said, the Delaware County in the next 2 months. That discussion, and the students are presenting in May, so I could do kind of that presentation in June, swimsuit bodies and business. But if anybody has anyone who would be interested or would be good for the tick-borne diseases, that would be excellent. Or if anyone has any other colleagues or yourself who has a topic that you'd like to bring up at a meeting and discuss, doesn't have to be 20 minutes, 10, 15 minutes, great. That would be great.
I think those are great topics, both of them. And I'd love to hear you talk about GLP and GIP injectables. That'd be wonderful.
All right, any other comments from the board? All right, I'll open it up for public participation. Do we have any public participation this evening? We do have a public meeting beginning in about 10 minutes. So if anyone's sticking around for that. Anything else anyone wants to bring up? Okay. All right, then I will adjourn the meeting. Our next meeting is on March, let me pull it up here.
And Lisa, I believe you have to get a motion in a second to adjourn.
Oh, yeah, that's right. March 17th is our next normal third Monday in March. Can I have someone to adjourn? Move to adjourn? Any second?
Second.
Great. Adjourned.
It's fun, isn't it?
I know, that's what you should do.